Welcome. So here we have a very short discussion on how to write D3, which is the big final conclusion for the Unit 10 Sociological Perspectives coursework under the BTEC Level 3 Health and Social Care course. So what we're being asked to do, you're being asked to write a summary. This is the 1/3 of your distinction criteria. It's a whole massive section on its own. It's just a distinction element, and you're being asked to do this. It says to evaluate the importance of the sociological perspectives used in a health and social care setting in relation to understanding society, reducing social inequality, and improving service provision for different social groups. That's a bit of a mouthful. It's a massive thing to do. So let's break it all down a little bit. So the first bit in there, it says evaluate the importance of. That basically means we need to talk about both sides of the argument. What is good? What is bad? What is helpful? What is not helpful? Does it help us improve services or does it not at all? So we're going to try and cover both sides, the good and the bad in this. The next key word there is sociological perspectives. Now we've covered a lot of these in section A for P1, for P2. You would have talked about what is sociology, what is sociological theory, and then in P2 you would have looked at the key theories of functionalism, Marxism, feminism, social action, and postmodernism. So that's what we're doing here. We're evaluating the sociological perspectives used in a healthcare setting. So how do we use the theory to help us understand healthcare settings? Think about your local GP, your local area that you've been discussing throughout the coursework in relation to understanding society. So this applies more to theories and models of healthcare. So how do they help us to understand the world around us? How do they help us understand healthcare systems and their workings in and for society? Reducing inequality, as the name suggests, does it help us to understand and reduce social inequality? So this will link more to P5 and P7, where you've talked about inequality in health between social groups. But there's also links here for P1, where you would have talked about the social groups and their use of healthcare. Elements of P3 and 4, where you looked at the models of healthcare and the different treatment of patients. P6, where you've done your local area research on your local setting and the health issues in your area. So this may have all highlighted inequalities, problems, but also particularly ways to reduce the inequality and provide access or better access to healthcare. How does it help us to improve service provision? Well, again, mostly for P6 here, how do you improve the healthcare services? How do you improve provision? And finally, for the social groups. So the social groups you've covered: class, age, gender, ethnicity, sexuality, religion, region, disability. You know, there's a whole range of social groups you may have discussed. But essentially, these social group discussions would have been key throughout your coursework, and I say particularly in those P5 and 7 discussions. So overall, what are we doing? So D3 is the overall summary. It's the final conclusion. It's the end of your fictitious report. So you, as a theoretical sociology student going off to uni, doing this as part of your application process, you've written a report for A and B on the theory of healthcare. And then your section C report, your second report, is your local area research on inequality in health and your local area. So what you're doing here is your final summary. Imagine this is how you would sum up your report to those interview panels at your fictitious uni interview. Now, what I would suggest is spend about a page and a half on each of the sections. So section A, section B, section C. So you're looking at maybe 4.5 pages in all, 5 pages if you sort of stretch it out. So as I say, I know that sounds a lot for a conclusion, but this is 1/3 of your distinction. It is a lot that you need to make sure you've covered to secure it. So what I would try and suggest you do is a brief recap at the beginning of each section. So section A, recap or conclusion, summarize the key things. What was that whole section about? What did you explore and talk about? And then move into the summary and discussion, trying to answer the question you've got on the screen. At the end of each section, come back to the question. The title of the coursework, the title of this project was, Can Inequality Make Us Ill? So as you're writing, come back to that question at the end of each little mini section, and then at the end of the whole coursework, come back to that final question and do a little extra section answering the question. So let's have a look at section A, P1 and P2. Now, P1 and P2 was your sociological perspectives discussion. So thinking about those first two sentences, sociological perspectives used in a healthcare setting, how do they help us to understand society? We can cover that quite easily. So what were the ideas put forward in explaining health and illness from the sociological perspectives? How do they reflect the practices in your setting? So in P1, you would have discussed different health needs. You could talk about your setting, the different groups using healthcare, the different needs of different groups. You could then go on to think about how the sociological perspectives would discuss the health needs, the healthcare system, the role of the healthcare system. So it helps us to understand, which is kind of that third purple part of that question, the understanding the healthcare setting, which is kind of my next point here. So do they show inequality causes illness? Do they help us to understand inequality? Do they help us to understand healthcare system? Think about, does the theory just explain the healthcare system, or does it help provide ways to improve it, or in this case reduce social inequality? So think some of those theories like functionalism, Marxism, feminism, they just tell you the social care system is functional, is supporting capitalism, is patriarchal. But there may not be much of a solution on how to improve it or reduce the inequality that it creates. So that kind of leads into my next point. Do they actually suggest any ways to reduce inequality, which kind of overlaps with the improving service element? Or does it just describe illness and why there is inequality? And what I would also suggest, maybe think about who the theories focus on. Are there groups that are ignored? So, think about, does it consider disability, sexuality, ethnicity? There are sociologists who talk about disability. So Tom Shakespeare is a really key one there, who talks about disability and society. But Marxism, feminism, those theories, do they cover these topics like disability, sexuality, and ethnicity? Moving on to section B, a P3, a P4. These are the models and the concepts of healthcare. So essentially this is going to come and look at trying to help us to explain the healthcare setting and think about the services. So it is kind of an understanding element as well. So what were the three models of healthcare? How do they explain the system? What is used within your setting? Generally, if you're talking about a GP, the likelihood is it's going to take a biomedical approach. But you might want to highlight that, there's been a shift towards more social models, maybe even more complementary models. So it's thinking about how the healthcare system works and is changing. Does this section help us to understand healthcare? Does it help us to understand inequality? Does it even help us to improve services? So these are the questions you want to ask when you're reflecting on the materials you covered. What is it actually helping us to think about and understand? The models might just explain the workings of healthcare. They may not actually give us any better insight into how they work or how to improve them. Do the concepts of health help us to understand healthcare? Do they improve services? Do they affect different social groups? So that's what we're going to think about here. And last but not least, let's move on to section C. So the final section, P5, P7. I've broken this down actually to P5, P7, and then we'll do P6 separately. P5 and 7 was your discussion on inequalities. You would have looked at social groups and inequalities. So it's kind of the second half of this kind of question from the criteria. So what does your research show? Summarize your findings. Highlight the key facts you found. What is the evidence of inequality in healthcare, healthcare provision, within your two chosen groups, or however many chosen groups you would have focused on in your write-up? Is there evidence of inequality? So try and summarize a few key findings. Don't need to repeat the whole thing, but give a general overview. What do the reports or the theories suggest about how to explain or reduce inequality? Do they provide evidence on how to improve services? If you've looked at social class, you would have talked about the Black Report, the Aiken report. You might have talked about the King's Fund surveys and reports. So what did they say about inequality? Did they give guidance on how to reduce it? Was it effective guidance? Were they followed? Were they used? And the Black Report was generally ignored, despite providing suggestions on how to do it. The Aiken report was taken on board by government. So again, what does that suggest about inequality? Is it just social groups and their health, or are there wider factors to consider? And P6, the final little part here. So this is your local setting, your local area research. So what is going on in your local area? What are the inequality? What are the health issues? What are the needs of your setting or your area? What is going on? Does your research help us to show that the data can be used to improve provision? What is the use of the data in your area? Maybe potentially highlight what are some of the problems in your area that need to be addressed, that need to be improved. What can be done? What will be done? What are the barriers to getting changes made? And lastly, does the data help us to understand society? Does it help us to understand the health needs? So you might want to look at your area. Does it highlight any issues or problems, anything that needs to be done better? Does it help us to understand? So it might be looking at Colchester's data. There's quite a high rate of under 18 conception, so under 18s becoming pregnant. So in terms of understanding our society, it highlights that there is a weakness in maybe sexual health education, particularly in the school levels. So that could mean that there needs to be better either accessibility to sexual health services, to sexual health advice, or sexual health materials like contraceptives to reduce that underage conception. On the other side, looking at STI rates in over 18s, very, very low. Essex has surprisingly got a very good record of low STIs. So it shows that the sexual health services are working for the over 18s, but not for the under. So again, that could be something that could be used to improve services. And that's what you're thinking about here. And that's what you would have discussed in your P6. Last but not least, the final summary, the final couple of sentences. This would be like your sort of standard 2 or 3 line conclusion at the end of an essay. Once you've done all this, come back to that big final question. Can inequality make us ill? Answer that question. Based on my evidence and my research and the discussions I've taken place, it is possible to see, or it is not possible to see, that inequality makes us ill. I think it's generally, we're leaning to inequality does cause illness. So you can answer the question. That's what I'd say be the final thing to do for this. So there we have it. So that's D3 of the coursework unit. A final summary. As I say, it's 1/3 of the distinction criteria. So put the time in. Make sure you're writing as much as you can. You're discussing the points. Hopefully what I've gone through kind of highlights ways you can make sure you are answering the exam criteria, the criteria at the very top of the screen there, to show the moderators, show your teachers, show anyone looking at your coursework you have answered and met this criteria. Obviously, as always, you've got to make sure you've done the distinction criteria well in the earlier sections. This is like a stepping process. All the pass has to be met to get the pass. All the pass and merit met for a merit. All the pass, merit and distinctions to be met for a distinction. So make sure, again, if you're spending all this time on D3, make sure your D1, your D2, the merits, your passes, they're all enough and sufficient to make sure you meet all those criteria. Okay, thanks for watching, and hopefully this will be of some use.